Is stubborn knee pain slowing down your runs? What if it isn't your knee at all, but your low back sending the pain signal? I'm Dr. Ray Peralta, physical therapist and a run coach, and I've been in the field for almost past 10 years helping runners get pain-free and hit their PRs or maybe finish their first marathon. In my clinic, nearly 1 in 4 runners with knee pain actually have a spinal source. It means their back is actually the cause of their knee pain symptoms. There are multiple studies showing that the low back, the lumbar spine, can actually refer pain into the knee. For example, a 2019 study showed that over 44% of people with chronic knee pain was actually coming from their back. So it was their back, not their knees, that was driving the pain. But by the end of this video, you'll know why your spine can mimic or fake knee pain, how to tell a true knee problem from referred pain, and 5 simple moves that can help you right now. And then what other signs can, help you also determine if it's really coming from the spine. So what we'll cover is the pain pathway mixes. How can your brain get this pathway mixed up between the spine and the knee? Diagnosing your problem, how you could self-diagnose. And now I know it's not going to be perfect, obviously, unless you're a trained physical therapist or a medical professional. It's going to be a hard time diagnosing, but at least some tools you can use to attempt to self-diagnose your problem. The link between your biomechanics, right, your knee and your spine, and what's the link there, and some self-tests that you can do to determine, hey, what is it really coming from your back or is it coming from your knee? There's some simple tests you could do at home. So pain pathways mix-up, number one. So convergence in the spinal cord. So lumbar and knee pain fibers actually can share spinal fibers. So for example, the innervation going into the knee is typically about like L2, L3. So it's going to be like upper lumbar, right, as a general rule. It may even go... so these spinal nerves sometimes can be impacted, right? So your brain can't tell the difference between which hurts. Is it the pain coming from the knee or the back, right? Are you feeling back pain or knee pain? So sometimes when you have a source that's in the back, you may feel it in the knee, even though you don't have the classic radicular signs of pain, radiating down the leg. There's this other thing called dichotomizing dorsal root ganglion neurons. So some sensory nerves split, one branch to the lumbar tissues, and again, one towards the knee. However, back pain can be felt in your knee without true nerve compression, right? So even though the nerve is actually not being pinched, you may even get an image like an MRI or something. You don't see any pinching of the nerve on the MRI, yet you can still have this nerve being aggravated. The nerve can be pissed and it's causing pain that's felt in the knee, even though the true source is your back. So how do you diagnose this problem? Well, true knee pain is usually just felt within the knee itself. It may shift from side to side with movement, make it radiate a little bit into the shin, right below the knee, but never radiates above the knee, or it never goes into the thigh or into the hip or the back, right? If that happens, it's most likely coming from the back or the hip. You typically don't have any numbness, tingling, or pins and needles or burning sensation, right? If you're feeling numbness, tingling, burning, that's another sign that's radicular type pain or nerve type pain coming from the back into the knee. Referred spinal pain can be felt around or below the knee. It sometimes goes into the foot, right? So you may have knee pain and foot pain on the same side. You may then also feel numbness or tingling. And as a general rule, not always, but sometimes you also may feel numbness and tingling. It may actually change your locations, right? When you're just sitting for a long time, you now start to change, hey, the symptoms change. Or like if you bend forward to reach your toes, now that bending forward may reproduce your knee pain. Or if you're just standing still, even though you're not even moving your knee, the knee may just start aggravating on its own. So what are the biomechanical links between the knee and the back? So a loss of your lumbar curvature alters your gait, the way you move, and can load the knee, right? So if you're now more kyphotic, you're more bent forward a bit, a little bit slouched forward when you're walking or running, that can actually cause the downstream changes and influence how the loading happens. So now your knee is taking up more stress, and then that may cause some knee issues. At the flip side, though, if you have like a really arthritic knee, that may cause like really tightness of the hamstring, and then cause kind of stiffening of the lower back, overloading the back, and now the knee can influence the back. So it could go both ways, bidirectional. The back can influence the knee, and the knee can influence the back. Another interesting thing to note that in many people with knee issues, even though it may look like arthritis, it oftentimes can also come from the back. So there are some cases where even as myself as a physical therapist, I worked with patients even though they showed arthritis in their knee scans, and a good portion of them would actually just get better with doing some back, lumbar spine or back exercises in just a few sessions. They were pretty surprised. Like, wait, I have arthritis in my scan, yet they got better with just doing back exercises. So, what are some self-tests or exercises you could do to see is your knee pain coming from your back? One simple exercise is the prone press-up test, or it looks like a yoga push-up. You're laying on your stomach, you push up, you're lying face down, hands under your shoulders, you press up, you lift your chest up. You do about 10 to 15 reps. So relax. You may repeat this for 2 or 3 sets. And if you notice that let's say you had this knee pain or ache, and as you're doing this exercise, that your knee pain starts to ease, your back may actually be the culprit. Right? I do this many times with my clients when I'm doing my assessment with them, like, oh, I have knee pain. All right, we do a couple sets of the prone press-ups, that yoga type push-up move, and now their knee pain starts going, like they can't even believe it. Like, whoa, this knee pain is just starting to abolish just because the knee pain was actually coming from the back. Another thing is to actually check your posture, right? So you can stand sideways in a mirror, lift your shirt up so you can see your lower back, the curvature. Aim for a gentle lumbar curve. It shouldn't be flat or slouched forward, nor should it be excessively arched. There should be a gentle kind of C-shape curvature, but also check if just changing your posture influences your knee pain. Sometimes people with knee pain that's coming from the back, just simply slouching to sitting up erect or standing erect, oftentimes that changes the knee pain. Maybe slouching makes it worse, and maybe going erect makes it better. But sometimes it could be flipped. So it's not always extension. Sometimes it's flexion. So you could do that simple posture check to see, hey, does your knee pain change with posture? Another movement you could do is like a cat-camel movement, because you could actually go from extension to flexion in mid-range. So your hands and knees. Again, cat-camel is like a yoga pose. You arch your back, right? Boom. And then you round your back. So you arch your back, round your back. Do that 10, 15, 30 times. See if that has any influence on your knee symptoms. Another thing you do is doing muscle activation drills, right? So doing a set of bridges, glute bridges to activate your glutes, Supermans to activate the lumbar trunk extensor exercises. And then see, okay, once you kind of warm up by just activating the muscles of your lower back and hips, does that help with your knee pain? Sometimes that muscle activation sequence, you may spend like 5 minutes going doing a couple sets, typically 3 by 10 repetitions, just again, activating the muscles of your hips and back. That may actually help alleviate some of your knee pain. Not always, but in some cases. And another thing you do is a bird dog. So this is going to help with stability and also core muscle activation. You could do a couple rounds of bird dog exercise, because now you're getting a little bit of hip extension, some back extension, and sometimes even doing this muscle activation exercise may help give you some decrease in knee pain. But I found most luck, again, just because I'm also trained in the McKenzie method, is doing the McKenzie prone press up, or that kind of yoga push up movement, and most of the clients I work with who are dealing with knee pain. And what are some clinical indicators? Again, there's another study in case you need. I did cover this earlier, but just to share the study from a 2022 study, they looked at 319 patients or subjects here, and they found 5 signs that, just from the history of the exam, that predict that the spine or the back is the source of the extremity or the joint pain. And even just 2 positive indicators is 80% specificity. So paresthesia, if you get tingling or numbness, big indicator that it's not coming from the knee itself, it's coming from the back. Your pain changes when you're sitting just completely still, or with flexion, bending forward, right? Or just standing still, that maybe it's coming from your back. Your posture, right? So slumped versus sitting, right? So if you're just sitting versus standing, and you just notice an immediate change in your knee pain, that's also another indicator that it's probably coming from your back. Or that your spine is very stiff, yet your knee moves completely fine, like you have normal knee range of motion. That's another indicator that the pain is probably coming from your back. So I'm going to share one of a case study. So I had a client, let's call her Alex, a runner in her 40s, marathoner. Despite MRI and even showing some changes in her knee, like it showed like some arthritic changes in her knee, and doing knee-focused PT somewhere else, her pain persisted. And the only time we started working together and just doing that simple prone press-up exercise, the ache just instantly started to resolve. Now she had to keep up with it, because otherwise the pain would come back in a few hours. So she had to continue throughout the day doing the exercise. But with some of the signs she had like some heaviness on the leg. She didn't exactly have numbness or tingling, but did have this feeling of heaviness that her leg felt heavy where it had the knee pain, and that that her pain would just change from posture, just slouching to kind of sitting up erect. After just a month of doing this spinal or back related this McKenzie method exercise, she was back to going on long runs, 10-mile long runs, pain free, because the knee wasn't the issue, it was actually coming from her back. So if you found this useful and you want additional information on how you can run pain free, check out the link in my description for a free training video.